So we're back. Sorry, just gotta get this thing started again here. So get rid of this here. All right, so now how is the respiration regulated? Activity of respiratory muscles is transmitted to the brain by the phrenic and intercostal nerves. Neural centers that control the rate are located in the medulla. The pons in the back of the brain, remember, appear to smooth out the respiratory rate to even it out. So people who can really control their respiratory rate, control their breathing, really have control of their pons. Normal respiration rate, it's called apnea, is 12 to 15 respirations per minute. You should be breathing in 12 to 15 times per minute. Obviously, when you hold your breath for swimming events or other kinds of things, it can be a little different. Hyperpnea is increased respiratory rate, often due to extra oxygen needs. You just breathe harder because your body craves more oxygen. It's like exercising and things like that. Okay, nothing terribly big there. All right. So here's a picture of the pons, medulla, controlling center, that kind of stuff. Sending signals on there, they're sending the signals to make the diaphragm expand and contract and pull these things in as well. And you have oxygen sensory and the aortic arch saying, hey, we don't need it. We don't have enough. We're not getting enough to the muscle cells, all that kind of stuff. CO2 increase in the blood is going to also act directly into this. All right. And so that's why when you hyperventilate, all right, sometimes you give up too much CO2. And if you give up too much CO2, this screws up this regulatory rate here. And so your body really doesn't know what to do. So that literally is why you can breathe into a bag. When you breathe into a bag, some of the CO2 that you are letting go is brought back in to help regulate. So you're not, people who are hyperventilating are getting rid of way too much CO2 and making sure, and it screws up your pons and the medulla. It's not know what to do. And so it doesn't really sync this up. So if you collect some of that CO2 back in, bring it back into your body, everything else is going to be good. So factors including respiratory rate and depth of this. Obviously, we talk about physical factors: increased body temperature, exercise, talking like this, coughing. You're getting rid of all of this air doing something, and so you need something that's going to come in. Plus, you can have what's called volition. Volition is where you're constantly controlling it, and you can train your lungs to breathe at more efficient rate. And obviously, some emotional factors are coming into play too. You're sad, you're happy, you cry, all that kind of stuff has something to do with that as well. Chemical factors. So here's the stuff that I was talking about. Level of carbon dioxide in the blood is the main regulatory chemical for respiration. Increased carbon dioxide increases respiration. So the more that you get there, increases it. Too much, however, is a big deal here. Changes in carbon dioxide act directly on the medulla oblongata. All right. Changes in oxygen concentration in the blood are detected by chemoreceptors in the aorta and carotid artery. So that picture with the heart showing you where that stuff was, and that information is spent to the medulla oblongata as well. So it's always a combination of those things making that stuff in. Okay. We will start about respiratory disorders in the next slide. Okay. Have a great day, everybody. And this, I believe, will be on Friday. Is when I assign this to you. So have a great, what's quoted as your spring break, and get these little assignments done. You should be good to go. Thanks. Keep being safe, everybody.